Welcome, everyone, to another edition of Benco's Driving Dentistry Forward podcast. Today, we are truly honored and flattered to have with us Dr. Rella Christensen of Provo, Utah, an award winner for this year's Lucy Hobbs Project Awards. She is truly a legend, and we're going to spend some time talking with her today about her career, how she got where she is, what she's learned along the way, and any wisdom she cares to share with us. So with that, I say, welcome, Rella. Thank you very much for being here with us today.
Thank you. Thank you, Charles. Believe me, it's all my pleasure.
Well, thank you. And first of all, congratulations on the award. Well deserving. Every year, we only honor a handful of women in dentistry. And it was obvious and a no-brainer for us to ask you to be part of this program and for us to honor you with this award. We're only sorry that in the coronavirus times that we're in, we can't do a real in-person meeting and an award ceremony. With an award, you stand next to when you get and take your picture taken. So this year we're doing the next best thing, which is a Zoom call. So welcome and thank you. All right, so Rella, let's just start pretty simple and say, you've had a lengthy career in dentistry, and as a microbiologist, many people probably don't know that you're not technically a dentist, you're a microbiologist. Can you talk to us a little bit about where you grew up, how your career progressed, and how you got to where you are today?
Yes, I'd like to. I was born and reared in Southern California. I was born in Pasadena. I was introduced to dentistry because my father and his brother lived next door to each other. And my brother and I kind of ran interchangeably between the two houses. Whoever wasn't angry with us that day, why, we'd go to that house. And my uncle was a dentist. And he graduated from USC back in the old days and was very technically capable. My father was a principal of high school, my mother a librarian. So I lived in a family where education was highly prized. And my uncle did just about everything he could to convince me that I should be a dental hygienist. And so I went to USC, and they tried to save money, I believe, by having the dental hygiene students sit in the first two rows for all the basic science classes. And so we took the same classes for almost everything except pharmacology and a few others. So I had a great basic science background and a great background as a clinician, and actually practiced as a dental hygienist and loved it for 20 years before I was asked to start the dental hygiene program at the University of Colorado. And I really was not an educator, had no plans to be such, but the program was legislated just 18 days before the students would have to start.
Okay.
And not only that, a part of the legislation said that if the program could not start on time, the money would be rescinded. And so
that's an incentive.
There was a definite scramble, and I just happened to be standing in the wrong place at the right time, and became part of that in educating dental hygienists. Back in those days, that we called them expanded function dental hygienists. Mm-hmm. They were educated to place resin-based composite and silver amalgam. Mm-hmm. As well as dual occlusal tracings, as well as radiography and some of the other traditional diagnostic gathering that dental hygienists did. And so this is how I got my start. Of course, when I was at USC, I met Gordon. Gordon was a Utah boy. He had traveled to Southern California from Utah. What a culture shock.
You might say.
Little tiny town, Logan, Utah, was a little tiny town at that time. It's grown a bit now, but we met there and fell in love and got married, and we both graduated together on the same day. He in dentistry, me in dental hygiene, and we became a team. And I learned dentistry from Gordon. I
That's
learned all of
inspiring.
dentistry. Basically worked right beside him. Did laboratory technician work as well as a number of other technical parts of dentistry with Gordon, and went to meetings and just kind of followed him around and learned a lot of things.
He's an excellent teacher. We all would agree with that. He's great. I was not aware that you were I was not aware you were a hygienist before you are in your current career. So that was news to me. That's interesting.
Well, I actually went back to school when I was 42. What had happened was that we saw the need for something new in dentistry. It was actually Gordon's idea. He felt that that dental clinicians should be evaluating the worth of the products that they used. Mm-hmm. At that time, all of the research was being done in the academic arena, which was great, beautifully controlled work. But we could see that once things left the academic arena, a lot of things happened to these products. And so in 1976, in the fall, we set up what was then called Clinical Research Associates, or CRA, and began the work, began to publish the information that we were gathering in January of 1977. Mm-hmm. The idea was a newsletter, a true newsletter, that would go to dentists to bring them up to date on the very latest products that came out. And what we decided to do was to gather products worldwide that were similar to one another, had a similar function, and to study them and to compare them and to rank them. And then to disseminate this information to clinicians all over the world. The Institute was set up as a nonprofit, and in the charter, it designated that money could not be received from industry or from government or from any other outside source that had a connection with dentistry. For example, even today, somebody, a dentist might have a parent that passes away, and sometimes they'll make a donation in the name of that parent, but this is a person that's a clinician and has no link to products or to dentistry. And so this charter was set up to make the foundation objective.
Nice. Independent, objective, very important.
That's what took me back to school. Gotcha. I felt like I needed to broaden out, and so I received a PhD in physiology with a strong emphasis on microbiology, and the reason for this combination was because it was designed to study the oral cavity and diseases of the oral cavity, which are often they are linked to the normal flora, right? And so we needed to understand the chemistry and the physiology of the normal environment to try to see what went wrong and what resulted when it went wrong, with the ultimate goal of trying to turn it around and make it right. And
interesting.
So we started CRA, which is now almost 50 years old.
Amazing.
And in disseminating this information, it was meant to be just a little newsletter among clinicians. But it turned out that there was actually a desire, an eagerness to know how to really rank different products and techniques and treatments, and be able to give the full picture, where you listed both the disadvantages as well as the advantages, and the contraindications as well as the indications. I guess I would have to say that complete information is difficult to find because we live in a fast-moving world, and it's filled with partial information and lots of marketing.
Yeah. Marketing is definitely where some people's heads are. That's correct.
And to get all the facts is very difficult. And you know, when you're going to in some way alter a person's body, Charles, to me that's a huge responsibility.
Yeah, indeed.
And I know that a lot of people don't think of perhaps dental treatments as altering a person's body, but if you really think about it, most of the treatments are quite permanent. They stick with the oral cavity and can have repercussions in the temporomandibular joint, dental caries. Who knows? This is what we're studying today, is the microbes in the actual dental caries lesion, and to see if they invade the bloodstream and actually affect the body negatively in general. So there are a lot of unanswered questions in this area. And interestingly enough, believe it or not, it's almost all microbiology. Dental caries, periodontal disease, oral surgery has a lot of microbiology in it, certainly dental implants. Probably one of the few areas that doesn't have microbiology might be occlusion. But dentistry is microbiology.
Very, very much so. So just go back. So go back a second. So it's been 50 years since you and Gordon really started, clinical research, or
just about. You got the exact date there, 1975.
Question. As you started it, I often think of CRA as a consumer reports oriented. Did you have that in mind when you started, that you wanted to make sure, sort of like an objective view of different products? Was that something that you actually thought of, or did that come later?
It did come later. We were more interested. It actually started with 7 study clubs. Gordon was mentoring these study clubs, and in those days, dentists would actually bring a patient into a central location. It might be one of the larger offices, or it might be a dental school setting. And they would actually treat a patient in an evening and then critique each other's treatment and talk about what had been done. And this was really the orientation. And I would have to say the start was probably dental materials.
Right.
More than anything else. And we branched out into these other areas as we soon learned that there were questions about equipment, questions about treatments in areas far beyond dental materials, and had to learn these areas.
Absolutely.
Yeah.
So one of the things you talked about, and I can't say it, I want to emphasize it because I just think it's so important, is we are all very grateful for the basic research that happens, whether it's the folks in Washington, D.C. in the federal government, or whether it's the manufacturers or the schools. But what you and your team are doing at CRA is hugely important. And your focus always has been on what happens actually in the doctor's office, which is slightly different, I think, than a lot of other research that's going on, right? So what you're doing is different. It's how does it actually work in the practitioner's hands and in the patient's mouths?
That is true. If I were to characterize it in today's language, I would say that we perform outcome studies. We purposely build in variables that normally in science, we're taught to limit the variables so that we can look at just a specific question. In our work, we invite the variables and build them in. For instance, we look for dentists that have been out of school varying numbers of years, various backgrounds. We look at purposely have those that have different levels of innate talent. We want to know what happens in the hands of the A plus technically competent person, and what happens in the hands of a person where they struggle a bit more. It is different in that way, and we monitor the outcomes over time. And it's very interesting to see how things their durability over time, because everything kind of degrades over time, if you will. Yes. You and I, we get wrinkles and gray hairs. And dental materials crack and chip and tend to have various degradation problems. And microbes, they mutate and they find new niches, and
they find little cracks and they get in there and they cause problems.
Can do. Yes.
So let's talk a little bit about what it was like. The thought I have is that you were one of the few women not to be a dental hygienist. That was probably not unusual at the time, but certainly as you went back to get your second degree, your PhD, it was a bit unusual for a woman to take on such a traditional science role. What was that like, and what were some of the barriers that you had to overcome along the way?
Because I had always followed Gordon around, I never really outwardly experience some of the barriers that a lot of women experience in dentistry. In basic science, I was on my own. And I went to Brigham Young University for a couple of reasons. The main reason was that it was close to my lab and I could get there quickly. The second main reason was I was already working in the microbiology labs and in the scanning electron microscopy labs there. And so I had access to the school there. I also had access at University of Utah in Salt Lake to the equipment and some of the professors that we worked with as consultants. This, Charles, is how we've made ourselves very broad. If we don't know something, we hire a consultant and we go, but we actually do the work ourselves with our own hands, but we've got them there as consultants showing us how and critiquing our work. But as I started this when I was just in my early 40s, I really didn't know the people in the general science area where I was working in the area where I would get a PhD in physiology. And I was not only the only woman, I was the only old woman.
Ah, interesting. We don't use the word old.
I could have been the mother to any of my colleagues.
That's interesting. That must have been an interesting experience.
It was. It definitely was. They had their study groups and their friends, and I was just a bit on the outside of all of that. Although these students were very welcoming and kind. I definitely needed to learn from them because I hadn't been in school for 20 years when I went back. And a lot had happened in that 20 years because if you look back in history, Watson and Crick defined DNA in about 1956 or so, and it hadn't quite made the textbooks, and I definitely didn't learn it in my dental hygiene or any of the work that was going on at USC. But basically, by the time I went back to graduate school, the math was new, all of the science was new, molecular biology was just being born. And today, of course, molecular biology is everything in basic science. Now, that's a point of view. That's my point of view, but that's...
No, I think that's a very good point of view. Certainly in dental basic science and dental basic science, I think there's
all the way across. Yeah, really anything biological. Let's put it that way.
Interesting.
And There were barriers. There definitely were, but they were based. They were based on gender and on age. But I found that just by keeping my nose down and my mouth shut and doing the work, that the work was allowed to stand on its own. And I'll give BYU credit for that. Times have changed. Today, I find the universities actually recruit not only women, but should I call them mature women?
Good call. That's a very politically correct thing to say. I like it. Right. Absolutely. No, I think that's really cool. Well, so many people out there are finding that they can they can reach their full potential. Sometimes it takes them a while to figure out what their full potential is and what they're passionate about, whether they're mature or women or people of color. I mean, getting everyone to really figure out what they want to be good at and giving them the opportunity to do so. I think your story is really inspirational about that. I suspect that if we were doing this interview not long after you graduated hygiene school, and I said to you, would you ever have any interest in being a PhD in microbiology or something? You might have said at that point, well, I'm not sure I could do that. But now look at you all these years later, vistas have opened up and you went back and you got training in a whole new area, which probably when you were in hygiene school wasn't even on your radar screen.
You're actually absolutely right. I took one semester course in microbiology in my undergraduate work at USC. And as you say, I had no intention of pursuing that area. I would say, Charles, that probably contra to a lot of young women today, I really didn't map my career out. In my age, women were homemakers, and even to graduate with a bachelor's degree in dental hygiene, I was the only one in the high school group that were my close friends that got a bachelor's degree in anything.
Wow. That's amazing. And it's only one generation, one or two generations. Look at the changes that have gone on. That's amazing.
There are probably more generations than you're giving it credit
All
for.
right, we'll see. We all look good on this call, so we're not going to go there. But in a relatively short amount of time, that's a huge change. That's a really huge change. And that's kind of exciting. How many people, what's the scope? Could you talk a little bit about the scope of the lab that you're in charge of? How many people do you have in the lab? What's the scope of it? Because I think people will be very surprised and impressed at the actual science that you've got going on at the lab in Utah.
Well, our lab does in vivo and in vitro. In other words, we do clinical outcome testing as well as laboratory testing, have from the very beginning put these together. We work with anything that dentistry uses. If we don't have the expertise, as I've stated before, we go out and find it and hire people as consultants, and we learn. And once you've been through these large evaluations, by the end, you know quite a bit, even though you may have been pretty basic when you started. So we look at equipment. We look at various treatments and techniques, as well as any kind of a product that is used by dentists. It could be a metal, it could be a polymer, it could be an instrument, it could be a large piece of equipment. Right now, we're evaluating a number of different cone beam equipment. We have been very, very involved this past year with trying to figure out how to keep the air pure in a dental operatory. The problem is not so much after equipment is used, but it's during the actual use of powered instruments, that actual period of use. If you're, let's say, cutting a crown preparation, you may cut it for anywhere from 5 to 10 or more minutes, maybe 15, maybe more. It's during that actual cutting that things get pretty contaminated during that time. Once you stop the actual cutting and begin to do the restorative procedure, things settle quite quickly and it's not nearly as critical. So, but we start from scratch, and we do have about 50 on-site people.
Wow.
And they cover various disciplines in material science and in physics and microbiology is my favorite area, but there are other very competent scientists. We have a beautiful scanning electron microscope that my husband bought me for our 50th wedding anniversary.
That's very romantic. Nothing says romance like an electromagnetic scanning microscope. I got to tell you, I'm impressed. That Gordon, he knows how to get to a woman's heart.
Yeah. And more recently, I'm more recently being about the past 15 years or so, we've done some very interesting work. We asked the question, what lives in a dental caries lesion? And we've tried to characterize which genus and species live in the actual lesion, and where in the lesion. We've developed a technique so that we can map the lesion and tell you who lives where and how many of those organisms are there as you proceed from the surface down towards the pulp.
Wow.
And what we're trying to do there is we're trying to figure out if we can develop materials, restorative materials, that will allow you to have all your bad habits and still control dental caries. And I'm talking about what I call therapeutic materials, materials that might be antimicrobial, or they may control the drop in pH when you have a fermentable carbohydrate in a food or a drink. Saliva flow is a difficult area to control. And today, so many people are involved with marijuana and don't understand that it impedes saliva flow. Yeah. And because they've impeded the saliva flow, they're already at risk for caries. And because their mouth feels uncomfortable, they'll often drink a lot of soda in a day, not one or two cans, but many cans of highly sugared soda.
Awful.
Which has a low pH. In other words, it's very acid as well as being high sugar. And so we're trying to figure out how we can control this oral environment. I guess mainly because I personally feel so unsuccessful in talking people out of
bad habits. Shall you say bad habits?
Well, they're unhealthy habits.
Unhealthy habits. Okay, that is a little too judgmental, but unhealthy we can agree on.
All of us can have a treat now and then, but when treats are your entire diet, or if you just are always too tired to practice any kind of hygiene, and then go to bed night after night with last Thanksgiving's dinner still on your teeth.
Yes.
And then, of course, there are a whole group of both prescription and non-prescription chemicals that cause the saliva flow to be diminished. And those three factors, the high fermentable carbohydrates, the lack of hygiene, in other words, leaving the biofilm in place for many, many days, and the diminishment of saliva through various habits. Just those three factors are enough to put you at very high risk for dental caries. In a developed country like the U.S., honestly, I believe dental caries is a preventable disease, and I think that many make that same statement.
I agree. But
the truth of the matter is, Charles, is that almost everybody's going to experience it at some point or another.
True.
And I have too. I'm not going to ask you about you, but I've had dental caries.
A little bit. We all have had a little bit, but a little bit is okay. It's extensive dental caries because it's not treated, that gets very frustrating, right? I mean, that's the thing you
I
say.
don't even like to see a little bit of something that's not necessary. I honestly feel that there have to be therapeutic ways that we can prevent this, and we're looking into that. One of the very encouraging things to me is for the first time, we're going to be seeing a resin-based composite that's claiming to be antimicrobial.
Oh, great.
And we of course have already seen the entry into the market several years ago of chemical treatment of caries. I'm talking about silver diamine fluoride. I believe there are better antimicrobials than that particular one, but it is the first commercial product that has come all the way through the process. And so I see things coming forward on the horizon, an acceptance of the fact that preventive measures can be used as actual treatments. And I hope that they'll be more successful than trying to get people to permanently change habits. And that's what it entails, a permanent change of habits.
Yeah, that's exciting. Well, good for you. One last question, just because I want to go back to your career. Can you identify for us one of the mentors who was very powerful in helping you shape your career? Not necessarily who it was, although certainly feel free to share, but more along the lines of how did having a mentor or a mentor figure really change your career? I think it's a superpower that people sometimes don't value enough, in my opinion.
The immediate person that comes to my mind is my husband, Gordon.
He's a good one. He's a real good one.
Being with him all the time and being chairside, I've worked as his hygienist, as his dental assistant, as his laboratory technician, not all at the same time, but at various times, and gone with him to study clubs, and through him have met some of the real pioneers and leaders internationally in dentistry, and had the opportunity to see their work and to learn from them and to be received by them, which would be very difficult had I just been on my own, because I really had no real influence. My uncle was a dentist, but he was not influential in the profession in general. He was influential in his circle of patients. So there wouldn't be anyone of the magnitude of Gordon, but a number of other people in the industry, people that I've met over the years, they too have been giants in trying to commercialize products and market them honestly and compete. It's been very interesting to see the competition and how there's always going to be competition, and it's good. But
very good
to be able to hold to your ethics and compete and run in that race nose to nose. All of those people have been mentors. I totally agree with you. Without a mentor, you can't learn nearly as much or as quickly. You're definitely limited if you are just on your own. And let me say, I'm a nerd. I wouldn't be one to jump up and speak out. I like to listen, and I like to watch, and I like to learn. So I wouldn't have made it without the mentors.
Wow. Well, as we close, I want to say, because I'm blessed to know both you and your husband. I am very certain that if I asked Gordon the same question I asked you, he would say one of my main mentors is my wife, Rella. And that's really what it's all about.
Nice, probably not.
Oh no, I think he definitely would. And that really is one of the things that I think everyone in dentistry, and I'll just speak for most of us who have been watching you for many years and appreciating what you've been doing, has been watching you as partners really drive dentistry forward, move dentistry forward together in a way that's been very, very complementary. And it's been really inspiring to watch. So thank you. And thank you for everything you do for our profession, because you and Gordon and your team have really done tremendous work over the past number of decades to really try to get the dental materials, the practice of dentistry to be better for our patients every day. So thank you very much for doing that. And really, that's why we were all, it was not a hard decision on awarding you this, presenting you with this award, because you and your husband, but you especially, have been tremendously helpful for our profession. And I thank you for that.
Well, thank you. That's very kind, Charles.
It's well deserved. So with that, Rella, thank you very much for your time. Thanks for sharing your thoughts on mentorship, on the profession, on microbiology. And with that, I will say, join us please next time for the next edition of our Driving Dentistry Forward podcast. Congratulations again, Rella, for your award and for everything. And thank you for everything you do for our profession.
Thank you, Charles. Thank you.